Okay, thanks very much, everybody. And today we've had a further positive update from our medical and scientific advisors. We've seen progress across all of the indicators in our fight back against COVID-19. And together we've been able to push down the weekly average number of our new positive cases, resulting in a fall of the R rate to between 0.75 to 0.95. We've had a reduction in the number of admissions to hospitals, 54 compared to 79 last week, and inpatient numbers 154 compared to 189 a week ago. The number of people currently in ICU is down to 14, and the number of active outbreaks in care homes is thankfully now in single figures. I'm heartened to see that our shared efforts are working, because that means that more lives are being saved. And this time last year, as we faced into the global pandemic, we had limited tools in our armoury. What we did have, however, was the power of our people coming together to take joint action to protect each other. Sacrifices, big and small, have been made and continue to be made, and we have all felt the loss of friends and family and of simple freedoms. But it says a lot about the spirit of the people of Northern Ireland that we have kept the faith and kept going. My heartfelt thanks go to all those on the front line, our doctors, nurses, carers, shop workers, farmers, emergency services and teachers, to all of those who left their home day in and day out so that we could stay safe in ours. And I also want to express my gratitude to all of our citizens who have made everyday choices for the good of others. I thank all those parents who have juggled schoolwork and jobs, and the good neighbours who have reached out to all those who have felt isolated. And I want to pay a special tribute to our young people who have been hit so hard this year with uncertainty over jobs, changes in education provision, and of course the impact on socialising and friendships at a stage in your life when that is so very important. The Executive have made children and young people an early priority as we move through our pathway out of restrictions, and today, as part of our ongoing commitment to support the emotional health and well-being of our children and young people, we have agreed the limited reopening of Sure Start and youth services. This includes with immediate effect the restart of in-person targeted and detached youth work, as well as the first steps in a phased return of generic youth services. The targeted provision will help meet the needs of specific groups of young people at greater risk of social exclusion or isolation, and detached youth work provision will see the deployment of our street teams in communities. A return of generic youth services will take place over 3 phases, initially with the reopening from the 1st of April of youth provision in safe spaces with limited numbers in line with Department of Health guidance. And this will include both statutory and voluntary youth work operating in line with overarching restrictions on settings, numbers and mitigations. It was also agreed that Sure Start services can recommence. Department of Education funded targeted early years provision, allowing face-to-face support for children-only based services is able to take place with immediate effect. The Executive has agreed this afternoon to extend the business support scheme, many of who are close contact services, along with the support grant for large tourism and hospitality businesses beyond March the 31st, for as long as the restrictions relating to those sectors are in place. We also had a discussion on the international context and the measures we need to take to prevent transmission of the virus, and particularly other new variants, as travel routes reopen here in the coming weeks. And in line with other jurisdictions, the Executive has been making preparations to introduce managed isolation in hotel accommodation for those arriving into Northern Ireland when international flights here resume. The Executive has agreed to adopt the red list approach, keeping relevant countries under review and arrangements flexible enough to enable a broader approach should the need arise. I'm delighted today the number of vaccines administered in Northern Ireland has surpassed 800,000 at 808,241. The number of individuals who have received a first dose is into the 700s at 703,334. And the number who have received both doses is now just under 105,000. Next month sees the further expansion of the vaccination programme as the large-scale operation at SSE Arena opens its doors. Our health and scientific advisers have told us that due to the successful rollout of the vaccine programme, we are seeing a reduction in new positive cases for the over 60s and are anticipating a similar drop in the over 50s. As you know, we have significantly benefited from the UK procurement of vaccines, which has ensured we have been able to roll out our programme swiftly and efficiently. And our vaccine programme does give us confidence that we will have increased levels of protection in our community from COVID-19, as this creates a strong foundation for our journey out of restrictions. Finally, our minds are very much now on recovery, but also on the wider picture of renewal. It is right that we continue to have important discussions on the kind of society we want for the future. So we are committed to meaningfully tackling violence against women and girls, and the Executive agreed today to develop a whole-of-government approach to the issue. A cross-sectoral task force will be established, coordinated by our office, the Executive Office, to ensure a strategic approach to tackling the root causes of all forms of such violence. And this will have a particular focus on behavioural and attitudinal change. We also committed to the strategy to combat violence against women and girls, informing our new programme for government. Thank you.
Thanks, Arlene, and good afternoon to everyone. Firstly, can I say that I'm so pleased to say that for the second consecutive day, no COVID deaths have been reported. And that's obviously very good news and a very welcome sign that we're continuing to move in the right direction. The daily average of new positive cases has declined over this last week. The R rate is currently sitting in the range of 0.75 to 0.95. New hospital admissions have slowed significantly, which is again very encouraging. As of today, over 703,000 people have been vaccinated, and a total of 808,000 vaccines have been administered. Again, this represents really remarkable progress and is a real credit to our healthcare staff who have worked tirelessly to plan to deliver the vaccine. Next week will be another step forward as the Regional Vaccination Centre at the SSE Arena opens, and community pharmacists also will join the programme. We continue to see evidence of the impact of the vaccination programme with a reduction in the proportion of new positive cases in the over 60s, and we expect to see similar reduction in the over 50 category as the programme rolls out further. A year ago, we could only have dreamed of an effective vaccine by this point. This Sunday, the 28th of March, marks 1 year since the new powers came into force that effectively shut our society down. I certainly will never forget that day and the enormity of the decisions that we've had to take to protect people. It was a point whenever all of our lives changed. Individuals, families, workers and businesses have all felt the negative impact of this pandemic. And let me tell you that the gravity of the issues we have been dealing with over the last year has not escaped us. As political leaders, we've been challenged like never before. There was no guide for dealing with a global pandemic, but what we have always had is a collective priority to do the right thing by people, to save lives and to support people the best way we can. Across our society, this has been a year of enormous personal sacrifice and a year of loss. And despite having to keep physical distance from each other, it's a year that our community has also really come together. We're deeply indebted to everyone who has provided care, support and the comfort to people when they have needed it most. Our focus is still very much on getting through this pandemic and to do so as safely as possible. We're continuing on our pathway out of restrictions in a gradual and a sustainable way. It really was great to see the full return of children to primary schools this week, and next week on the 1st of April some further easements will also come into effect whenever more people can get together outside, and there will be up to 10 people from 2 households will be able to take part in some outdoor sporting activities. Today the Executive has also agreed the limited reopening of Sure Start and youth services aimed at supporting vulnerable young people. We know how deeply affected our children and our young people have been by the pandemic, and the resumption of these targeted interventions is hugely important and very welcome. We also discussed in some detail today the issue of international travel. This is a fundamental concern for us all as we seek to manage the risks that are arising from the new variants. And in line with the scientific and medical advice, we have agreed the introduction of managed isolation in hotel accommodation on return from red list countries for a period of 10 days to be pre-booked before arrival here. This will be kept under review, and our arrangements for managed hotel isolation will be flexible to enable a broader approach on international travel to be put in place should the need arise. Passengers arriving from red list countries must also have completed a pre-departure COVID-19 test and must undertake pre-booked tests at days 2 and 8 after arrival. On a separate but critically important issue, the Executive gave further consideration today to a strategy to end violence against women and girls. And this is an issue in which we are all united, and it's something that we take extremely seriously. We've all been witness to the appalling abuse of women and girls across our society. It devastates lives, and as we have seen far too often, it takes lives and robs families of mothers, daughters and sisters. It must stop. Today we have committed to working together to tackle this issue through an executive-wide violence against women and girls strategy. This work will be coordinated by the Executive Office and will have a focus on tackling root causes of all forms of violence against women and girls. We hope that this sends a very clear message that the vile misogyny that prevails in our society will be rooted out. The discrimination and the denigration of women will not be tolerated, and we will stop at nothing to ensure that women and girls are safe and also that they're protected. Thank you.
Good afternoon, Tracy McGee, UTV. Just for clarification, you say that you're going to adopt the red list approach. Can I check, first of all, is that the one that would agree with the UK? In which case, will there be a difficulty if that list does not agree with the Irish red list? And secondly, a statement from Brian Ambrose from the City Airport has been very critical of the Health Minister and the CMO, saying that their comments were both premature and unhelpful, and that they wanted to hear about the arrangements from the Executive itself, and they had expected that they would get recommendations from the Global Travel Task Force on the 12th of April. So what would you say to Mr Ambrose, who obviously thinks the way that this is being handled is not good?
Well, the Health Minister isn't here to defend himself, but what I will say is that we have adopted the red list approach. Actually, there's not much difference between the United Kingdom red list approach and the Republic of Ireland's red list. But of course, that's open to change, and we have to be very conscious of that as we move forward. As regards the Global Task Force, Mr Ambrose is correct. That hasn't yet reported. It reports on the 12th of April. Our own officials in Northern Ireland are working with Scottish, Welsh and English officials in that global task force, so we will await to hear what they have to say in relation to international travel for the summer when we get that report on Monday the 12th of April.
I think the more aligned and consistent we can be across these islands, I think it'll be to our benefit. So I welcome the fact that there is that ongoing conversation, and the red lists are similar. We've also built in the flexibility that we can expand or relook at that, because I think the threat that's posed from international travel is a real threat, particularly given the new variants. And I think, unfortunately, it's not just about what happens here, it's about what happens elsewhere in Europe that will have an impact in terms of the virus transmission. So I think that that's going to be a watch and brief, and we're going to have to continually keep that under review. We've made some progress today. And then on the issue of on travel and holidays, you know, people are really desperate for something to look forward to, and I understand that. I feel that myself. So I think that it's really understandable that people will be very disappointed by what was said yesterday. I think it's just about trying to be honest with the public around there's so much uncertainty around what's going to happen over the next number of months, and you know, it's still difficult to predict just whether or not there will be travel or not come the summer period. All we can do is just keep people informed along this journey as best we can. But clearly, you know, we've got to a really good point today, and we want to keep that going. But we need to be gradual and sustainable in terms of easements and what we're able to lift. But I understand the public's frustration. I understand people's, you know, wanting something to grab onto. And we hope to be able to give clarity when we can. Unfortunately, it's just too far out at this stage to be, you know, to be 100% guarantees, to give people 100% guarantees, because you can't do that in a pandemic.
Can I ask about the very controversial issue of abortion? My understanding was that the Communities Minister was going to try to bring a paper today, and that hasn't happened. Yourself, Deputy First Minister, you said you wanted the matter brought to a head. So my question is, what happened today in the Executive? And if the paper was blocked again, does that mean that the parties, all the parties, the DUP included, would be happy enough for Brandon Lewis to legislate on this matter, as he said he would?
Well, firstly, Westminster shouldn't have to legislate for something that's within the devolved competence. So I think that the Executive needs to take a decision on this issue. And my very clear view is that 1 year post the legislation being brought into effect, women are being failed access to modern compassionate healthcare. And this is about healthcare. This is about women getting access to healthcare. So I believe that it's been a failure that those services haven't been commissioned. I note today that the Health Minister has stated that services are provided across each of the trust areas. However, it's not done from a central point from the Department of Health, and that needs to change. So you're right that Minister Hargey tried to bring the issue to the Executive. It didn't get onto the Executive agenda. But I expect that after the discussion today that the Health Minister will have to bring back new proposals to the Executive, and the Executive needs to take a decision on this issue, and it should be to commission services.
Well, of course, our position is very clear that both lives matter, and whilst we've spent this past year trying to save lives through COVID-19, we should also try and save lives in the womb, and that's our very clear desire and wish, of course, to support young women and women of all ages actually who find themselves in a crisis pregnancy, but to provide that support to them. The Health Minister has pointed out, and it's quite wrong of Brandon Lewis to talk about the fact that no abortions are happening in Northern Ireland. Of course, that's not true. Abortions are happening in Northern Ireland since last year. The trusts do operate on an ad hoc basis. I just can't remember the number. I think it's somewhere in the region of 1,000 abortions happened last year. So it's quite wrong to say that abortions haven't been happening here. And of course, we deeply regret that to be the case. So this is a hugely complex, controversial, legally challenging issue for the Executive, but let us be very clear, it is for the Executive, it is not for Brandon Lewis, and I think not only did my colleagues make that clear today in the House of Commons, but a number of Brandon Lewis's colleagues made that clear to him today. The reason why he brought it to the House in the first place was that there was no devolution at the time. There is devolution now, and he should back off.
Gareth Gordon, BBC. Can go back to the holiday situation briefly. Do both of you agree with Robin Swan's comments yesterday, and indeed the Chief Medical Officer's comments today, ruling out foreign travel for the summer? Michelle O'Neill, you didn't seem quite as definitive as Robin Swan. You seem to be leaving the door open to the possibility of foreign travel. And if foreign travel is out, what about travel across the border? If people can't go abroad, they may want to go to Kerry or Mayo or Cork. But we know the vaccine situations down there are a very different one than the one here. So if it's not safe to go to Italy, is it safe to go to Dublin for holiday?
Well, I'm merely making the point that there's so many uncertainties at this stage. I mean, I think that we don't know what the situation is going to be in a month's time, 2 months' time, or certainly, into the late summer. So I just make the point. I mean, I absolutely 100% accept what the Chief Medical Officer has said in terms of the prediction that he has made, in terms of the uncertainty. We don't know how things are going to be shaping up across Europe. We have to factor in all these things. So I just think that you can't give people the guarantee that they wish in terms of travel at this stage. All we can do is just give people the information as we know it. So we'll continue to work with Health on the issue of travel. But it's really important that we work across these islands on the issue of travel. That is our strength. We need to work together, north to south, east to west, and have common approaches to the issue of travel if we're going to deal with what are emerging variants right across the board.
So I think it's too soon to say whether people are going to be able to go on international travel or not. As I've indicated, the Global Travel Task Force is reporting on the 12th of April. Our officials are working through that with other officials from Scotland, Wales and England. So we look forward to receiving that report. So my view is it's perhaps too soon to be booking your holidays, but it's also too soon to be ruling them out as well, because we haven't had that report yet.
Can I ask you both essentially as well about Irish language legislation? Arlene Foster, who speaks for the DUP on the Irish language legislation? Is it you? On the 8th of March, you answered in the Assembly that, as the member will know, that's part of a package of identity and cultural pieces that we'll be bringing forward under NDNA, and it's our intention that will come forward so that it will be completed by the end of this mandate. You even said Sinead. This week, Ian Paisley told the BBC, he warned Brandon Lewis, this is on the abortion issue, that there would be serious consequences for devolution because of what he was doing, and he said his move does not create a good atmosphere for progress on issues such as language acts and things to do with our culture and our identity. That would appear to me to be a threat that perhaps the DUP will block Irish language legislation. And Michelle O'Neill, what do you think about what Ian Paisley said, and what would Sinn Féin do if the DUP moved to stop Irish language legislation?
Well, Gareth, I think it's important to look at what I did say on the 8th, and I talked about the fact that it was part of a package of culture and language. I mean, I know some people just want to talk about the Irish language, but of course we should be talking about the Ulster British Commissioner, the fact that we have a central office as well. And I think that sometimes the narrative seems to focus just on the Irish language, as if there's only one identity in Northern Ireland that is of importance, but of course that's not true. The whole point behind New Decade, New Approach was that people were to have respect for each other's identities. And unfortunately there hasn't been much of that recently, as you've seen through the Centenary Stone being blocked in the Assembly Commission. And the language that has been used by Sinn Féin in the Chamber, referring to Prince of Wales Avenue as POW Avenue, hugely offensive issues. So if we are to move forward in relation to New Decade, New Approach, it has to be all of identities being respected, and it has to be dealing with all of the issues in New Decade, New Approach. So the need to have 7,500 police officers is a commitment in New Decade, New Approach. We need to see that being complied with. There's a whole range of issues in New Decade, New Approach that need to be followed through on, and I very much hope that we do follow through on all of those things, because that's very important for democracy and it's very important for devolution here as well.
Can I just say, in terms of the Irish Language Act, it's not a pawn. It's not a pawn to be used in the middle of a game, or it's something that's about inclusion, and I very much look forward to having the Irish Language Act delivered as part of the package of culture and identity measures. I want to see all those things brought forward, and it's important that we live up, and that the Executive lives up to the commitments that have been made, and certainly that's where we need to get to. And I think that, you know, in political leadership, we all have a job to try and create a more inclusive society. I'll play my part in that. Inclusion is a good thing, diversity is a good thing, parity of esteem is a good thing, equality is a good thing. And I'd like to see us working together to deliver on all the commitments that were made. But certainly the Irish Language Act must be delivered. It's not up for renegotiation. It's not up for further discussion. It has been agreed upon politically before, and it needs to now be delivered.
When you look at global cases, they are quite low, but when you look south of the border, the cases are struggling to get below 500 to 600 cases every day. Look across Europe, similar type of thing, they're struggling with surges. How concerned are you about a surge in cases or new variants affecting the local cases?
Well, it's very important that we continue to monitor the situation with new variants. It's why we need to take into account the international travel situation. That's why we moved to the red list situation today, and that we will have accommodation available for people who come in on international flights directly into Northern Ireland, so we try and cut down on those new variants coming in. And of course, because of the vaccine rollout in Northern Ireland as well, we are now beginning to see a reduction in the number of people going into hospitals. We've talked about the fact that there seems to be less people over 60 now who are contracting COVID-19, and that's probably working through that they have had their first dose of vaccination. I'm looking forward to getting my vaccine very soon. The over 50s will soon be in that situation. So very much want us to continue with the vaccination programme, complete the vaccination programme, and hopefully then we can absolutely move to a summer when we can enjoy being together again, because that's really important for our people, and it's also very important that we're able to open those industries that have been closed, the hospitality industry, the retail industries. Frankly, they've suffered so much over this past year, and we need to be able to get them open, and that's why the vaccination programme is so very important.
I think we are in a good space, and it's probably a combination of reasons. I mean, the vaccine programme has been so successful and we're reaching so many people, and that obviously is keeping our new positive cases, keeping that number low. But we have to be very mindful about what's happening. This is a global pandemic, and what happens in one part of the world has an impact here also. So when you look towards what's happening in France and Germany and other countries, you look at the new variants that are prevalent there. I mean, it just takes one case to be here, and then obviously that has a spiral effect. So I think we'll have to be very mindful of that. Certainly that's the advice of the medical and scientific team at our executive meeting earlier today. So we have to watch all that very carefully. Unfortunately, it's not just down to what happens here, it's what happens elsewhere as well that actually has an impact.
Well, just on that, considering the high uptake of vaccine, the high doses that have been administered to date, like in the Republic, it's quite slow, and although they have plans to upscale that significantly over the next few months, how much of an impact will their vaccine rollout impact on the North easing its restrictions? And then what about how that impact on cross-border travel as well?
Well, this is something we'll take advice, obviously, from our medical advisors on. He has been very clear in the past that if people without the vaccine come into contact with people who have the vaccine and they have COVID-19, then you can actually damage the efficacy of the vaccine. So we need to be very clear as to what happens when most of our population is vaccinated, if it is still the case that the Republic of Ireland is further behind. So we will, of course, be looking at these issues as they come before us.
And clearly the 26 countries is further behind in terms of the vaccine, but it's not a competition. We need to support each other. We need to work together, and we need to share vaccines where we can. We need to just continually work together to fight this pandemic across these islands. And I think the more cooperation we can have, the more successful we'll be, and the quicker we'll get to the other side of this.
Good afternoon, Ministers. In terms of the travel this summer, if it is more towards the staycation, will there be similar schemes like you brought in with hospitality as in terms of the Eat Out to Help Out to help people maybe afford to have a staycation? Because we have been hearing from people that prices have dramatically increased for this summer for local travel.
Well, I think, first of all, it's very important to point out that the Help Out to Eat Out was a national scheme, and I think we would need to see where the financial wherewithal was to do that sort of scheme again. Obviously, as I've said, the Global Travel Task Force reports on the 12th of April, so we'll know then where we are in relation to international travel, and we'll be able to look at whether we can have international travel then, or whether it is the case that we will have to remain within our own jurisdiction again as last year. So we'll take all of that into consideration after the 12th of April.
Yeah, I mean, we have to sort of wait and see because we don't know what the situation is going to be. But, we've tried the whole way through this to try to support local businesses that have been struggling because of the pandemic. So we take all those things into consideration in terms of what we can do in terms of supporting the local industry and supporting families, obviously, who perhaps have paid for a holiday, they may not get on the holiday, all those things. So we'll have to keep all those things under review.
In terms of services in hospital, has there been any update from the Health Minister in terms of pregnancy and both parents being able to attend the scans and the births as well? Is there going to be any movement on that with cases continuing to fall in hospitals?
Well, I think both of us would certainly hope that it does happen, because we know how traumatic it is to give birth at any time, but to be on your own is very, very difficult. So that's something that the Health Minister has not updated us on recently, but I have queries in myself in relation to general visiting, because that is very restricted as well in hospital at present, so we need to look at that as well. Of course, recognising the need to keep hospitals a safe place for patients. I mean, the last thing we want to do is to cause any problems for our hospital staff.
Yes, and I would support the Health Minister in that being the case, because you do need that support whenever you're giving birth. And also for the wider hospital visiting, people have in hospital and then not getting anybody to come in to see you is very difficult. So what we want to see is the pressure being taken off our health service and scaling again of normal services, going back to the normal day-to-day business of the health service. But I think all those things are going to happen gradually, but certainly we would support the Health Minister in looking at the visiting piece. Okay, thank you. Ooh.